Hi, friends. Hey, I hope everybody can hear me. Let's see. If anybody wants to just give me like a thumbs up that they can hear me, that would be amazing. I'm giving myself a thumbs up, as you can see. Can you guys hear me? I see Pat. Yeah, awesome. Wonderful. Hi, Pat. Great. So we have a small group. I wasn't sure how many people would join today, but that's wonderful. This is just a very casual, low-key pelvic health Q&A. And so I thought I'd use this opportunity just to connect with folks and see if anyone wanted to chat about pelvic health. It can be about anything. And I used Zoom, or I chose Zoom because it's really nice to actually have a conversation. So right now everybody is muted, but what I'm going to have you do is if anyone has questions, I'll have you place them in the chat. Just type them out. And then as I can answer them, I'll go through the chat and have you ask you to unmute yourself, and we can help you with that. I think you might have to ask for permission to unmute, but if you have a question, go ahead and type it in the chat right now. We'll just get right into this, and perhaps some more folks will be joining us as we go. So hopefully you guys can access the chat. I'm happy to answer anything that I can. I'll do my best. And just to give you kind of information about who I am Brianne Grogan. I'm a doctor of physical therapy, and I specialize in holistic pelvic health. So I work with all sorts of people all over the globe, and my programs are mostly online. So I do have some in-person work that I do, but I mostly do online work through my YouTube channel, youtube.com/vibrant pelvic health. I have 773 videos at this point. And I also have programs. So I have online programs that are step-by-step guided programs. One is called Overcome Pelvic Pain for women, and that is for people with pelvic tension, pelvic pain, painful sex, bladder urgency and frequency, feeling like you always have to go. That would be a perfect program for somebody who has, or Overcome Pelvic Pain would be a perfect program for someone with those symptoms. And then I have another program called Lift for prolapse relief. And that is for people who have pelvic organ prolapse or bladder leakage, like when you cough or laugh or run across the street, you leak. It's also really wonderful for people who are preparing to have a baby, preconception time, or for women who've had a baby and want to recover their strength postpartum. And it's great for people who are preparing for pelvic surgery or abdominal surgery. So if you know you're going to have surgery, then this is a great way to prepare. I always say if you don't fix your pelvic floor problems, they're going to follow you. And so it's an amazing idea to go into surgery, even if you need a hysterectomy or a prolapse repair, to go into it as strong as possible and really understanding how to live a pelvic floor safe lifestyle. So those are my two main online programs. And again, it's Overcome Pelvic Pain and Lift for Prolapse Relief. I also have a brand new program called the Academy, and that is the mental and emotional work of pelvic health. It's truly like next level information for people who want to take that next step into pelvic health, but also personal transformation. I've had people literally feel like they can finally know themselves. They can finally take care of their health and prioritize their health. Some people are even starting new careers. Like it's pretty wild, the transformations that can happen when you really learn and practice tools of embodiment and getting to know and trust your body. Okay, so all that being said, that is who I am and what I offer, but we're here now, and this is your time to chat and connect with me. So I only have one thing so far in the chat, and I'm happy to answer that. But I want to let anyone know who's watching, if you have questions, just type them in. I have an hour blocked out for this, and we'll see how many folks join, but hey, I'm here. So let's connect. So if you have a question, just put it in the chat. So KK says, is there a role for trigger point injections, medications such as gabapentin in treating pelvic pain and tension? Okay, so the first thing I'm going to say is that so medications and injections, of course, I'm aware of this, but it's not my specialty. I don't offer these services because I'm not a medical doctor and don't offer, I know that some different types of providers can do trigger point injections, but I don't offer that. So, to be honest with you, I don't have a lot of incredible depth of knowledge about different types of medications and treatments that are non conservative. I know a lot about conservative treatments, exercise, holistic ways to help pelvic tension and pain, but not so much about the medications and trigger point injections. But I will say that, in my opinion, the role of these types of treatments, trigger point injections, medications, is to take the edge off, relieve the pain, and provide a temporary solution to essentially get you through so that you can participate in the conservative types of treatments that I and other physical therapists offer, such as the relaxation training, such as the stretches and exercises and embodiment practices that get you into your body. Because when you're in extreme pain and have extreme pelvic tension, honestly, the last thing you want to do is be in your body sometimes, right? You just are out of your body. And so sometimes medication is a beautiful way to, like I said, take the edge off and allow you to have some relief so that you can get into your body and do some of the work that I believe is going to give you the more lasting changes that you really need to make long lasting changes. I truly believe you need more than a medication or a trigger point injection. I believe you need to get to the root, which is often learning how to manage your stress, learning how to be in your body, learning how to not fear your symptoms. But if that requires taking the edge off with some medication or an injection, then I think it's totally worth it. Everybody's so different, though. So that's my thought there. And so far, no more questions. So, y'all, actually, what I'm going to do is ask KK if you're still on the call. If you would like to unmute yourself, you're welcome to. I think you might have to request to unmute, but if you want to have a convo with me, go ahead and do that. Again, that's why we're on Zoom right now, is so we can have a chat if we would like. Okay. KK says, thanks, hope that all the conservative options will help. Yeah, totally. And it takes patience and it takes time. And that's the hardest part, is just, I mean, I get it. Like, you've probably been around the block, you've been to many providers, you've tried a lot of things, and it can get frustrating. And so, one of the hardest things in pelvic healing is keeping the faith. And so, I just can tell you, if you need some faith, you can borrow mine. I've seen so many people get through this. In some cases, for some people, they say this is hell going through this. And I've seen so many people get through it. So just keep the faith. I know it's hard, but keep going and do what you need to do. And I always say focus and release. Focus on doing what you can do right now. Do it. As far as like pelvic rehab, or again, if you need the medication right now, the conservative treatment, the stretches, the exercises, the relaxation training, focus on that. And then release and go out and enjoy your life. And remember, you're so much more than your pelvic floor issue. You have probably a lot of things going on in your life that are working for you, that are working great for you. And so focus on that, and, release the focus on the pelvic floor as much as you can. Easier said than done sometimes, I know, but give it a try and know that I'm thinking of you. Okay. So Windows 10 says, my pain is only on one side and mostly is when I sit down. Is it necessarily pudendal neuralgia? My MRI is normal. Um, you know, this is something that, I mean, I certainly can't give you a diagnosis, but it could definitely be, it could be pudendal neuralgia. It could also be due to an imbalance in your alignment, the way you hold your body. You could have some muscular imbalances that are causing tension on one side, that are causing muscle tightness on one side, that are then irritating the tissues, structures, and nerves on that one side. So it's hard to say. It could be an alignment issue that's causing a muscular imbalance. It could be an issue like pudendal neuralgia. Pudendal neuralgia, of course, is very common when you're sitting. A lot of people experience symptoms when they're sitting. So that does lead one to believe that could be involved, but it's hard to say. So I would encourage you, if you're having those types of symptoms, definitely see a pelvic floor physical therapist for an evaluation if you have access to somebody. And a pelvic floor PT is going to take a look at your alignment, your posture and your alignment, the way you hold yourself, any muscular imbalances, your strength, your tightness. They'll look at all of the muscles around your pelvis and your core, your back, your legs, and they'll look at your pelvic floor. So they're going to help you with all of that. And then if you needed some at-home work, I mean, of course, I have a ton of videos for stretching and relaxation on YouTube. And then my Overcome Pelvic Pain program is wonderful. No matter what you have going on, if you have pain in that pelvic area, those videos are going to help you with the relaxation aspect, holistic approach, total body relaxation and mindset, and understanding how fear and anxiety and stress play into that pelvic pain and that tension and can exacerbate the pain and tension that you already have. And so we get to the root of that by working on the mind-body connection and also give you stretches to help. So yeah, I hope that gives you a little feedback. If you Windows 10, I'm not sure who you are here, I'd say your name otherwise, but if you want to just sort of like troubleshoot with me right now, you're welcome to ask to unmute. So I'll just wait for a moment for that. And does anybody else have any chat or questions? Go ahead and add them in the chat. I'll take a sip. This is our time to jam. Windows 10, are you interested in chatting with me? Nope, nope, nope. Okay, no worries. Who else has a question? We've got to have questions. I'm here for you. I'm here for any questions. I'll do the best I can to give you what I can without being your provider. Of course, this is not medical advice. I should have said that at the beginning. This is general educational information. Windows 10 says, my name is Natalie. I did therapy for 10 months and not much changed. Yeah. And that's where my question would be, what did your therapist do with you? Every provider is so different. And so it's very important, in my opinion, to go to a provider that you can see in person and work with in person if you have access to that. That being said, every provider is trained differently and has a different worldview and a different approach. And sometimes the approach that people need is more of a mind-body approach and less of a stretches and exercise, physical, structural approach. Sometimes it's the other way around. Somebody really needs that structural, physical, manual therapy, exercise, stretches, body-based approach. But if you're receiving the approach that does not work for your needs, then it doesn't necessarily mean that therapy doesn't work or physical therapy doesn't work. It's just that maybe you don't have the right therapist. Maybe that therapist isn't providing you with the treatment and help and support you and your specific condition needs. And so that's where it can be helpful to see about finding a different provider. The other thing is, if you weren't getting success from more of a body-based structural physical approach, and I think, Natalie, you said that the MRI didn't show any issues, your MRI was normal, that may be where you do need to look for a more holistic mind-body approach, because so often our nervous system is on high alert from the pain. And really what we need is to work with the nervous system, calming the nervous system to help calm the body and tame the pain. And that's what I do. So, I mean, if you were interested in that kind of work, I bring that in to the body-based exercise type things as well. But not all physical therapists do that. They don't always have time in their busy schedules. And so that's where programs like mine can be really helpful. So I'll just offer that. You just might not have found the right therapist for you. So don't give up. Don't lose hope. Okay. So I'm going to answer Suvi's question next. Suvi says, have you had anyone go through the academy before completing Lift or Overcome? I am partway through both programs and struggle with emotional issues that make it difficult to eat enough, leads to weakness, and very challenging to move forward physically in the programs. Hoping the academy will help me look more deeply within and make a breakthrough so I can get stronger and move forward. My therapist, who also does somatic work, is fully supportive of me joining. Husband is supportive too. Can I join even though incomplete in Lift? Suvi, if you want to unmute yourself, you're welcome to. You just ask to unmute yourself. I think that's how it works. My husband is co-host right now, and he can let you in if you want to chat. But yes, so my program, The Academy, is really about this nervous system work, the somatic work, dropping into the body, really understanding the big picture, mind and body, nervous system, all of it, not just exercises. So in the academy, I don't give a lot of background information about a specific issue. Like I'm not going to talk a lot about like what prolapse is, or I'm not going to talk about what bladder leakage is, or like why incontinence happens. I don't really offer those basics. That being said, you don't need to have been through Lift or Overcome to do my academy. It's just helpful because my Lift and Overcome program are more specifically for individual specific conditions, right? Like Lift more talks about and educates you about prolapse, what it is, why it happens, where the pelvic floor muscles are, what prolapse looks like, etc. Overcome more educates about pelvic pain, pelvic tension, kind of why it happens, specific exercises to help. The academy is more of a big picture approach, so it can be helpful to have some background information before you join, but you don't have to. So I would welcome you to join. And Suvi, right now we have I'm starting a fall cohort. So if you join right now, anyone watching this right now, there's a coupon code FALL and it saves you money and you get a welcome call as well. So I hope that
Okay, yeah,
helps. Oh,
that
yes.
sounds yeah,
Yes.
that sounds awesome. And I just want to say for the record, for anyone who's thinking of Lift or Overcome, they are super excellent. I love them both, and I do them every day. I just that my issues are, and I've been seeing a therapist who's been very helpful, but she does some somatic work. But anyway, the group work and the other stuff, I was hoping that maybe I can sort of make some more breakthroughs because I've done some and it's been awesome. But yeah, I just want to yeah, I just want to be able to embrace your programs fully because I feel like some mental or emotional or combination of things are kind of in the way.
Right.
And yeah, so okay, awesome. Yeah, I think I will. I've already had the go ahead from everybody else that I that and I'm just like, okay, this is yeah, I think this is my next step. So thank you very much. And I kind of should probably sneak out of here because I just jumped out of something in the middle just to come and I was really wanting to
Yes.
ask you. Okay, so you guys take care and anybody else who's struggling, I'm so sorry. It is a really tough ride, but Dr. Bree has amazing resources. Check them out. I'm fully like so excited about if I can get past some of these some of this stuff. I really want to complete the programs and so yeah.
You
So
will.
thank
You
you.
will,
Yeah,
Susie. You will. And yeah,
I will. I will.
yeah,
I do believe I will. So that's why I'm just like, okay, this is for me. This is
yeah.
the next step for me. So,
Good.
okay, thank
Okay.
you
Amazing.
very much.
Yeah, you're
Take
welcome.
care.
Thanks for being here.
Oh,
Okay.
thank you.
Yeah.
Bye.
Bye. And I think that, let's see, I think there was another. Okay. So, okay. KK asked another question. After completing the Overcome program of 12 weeks, approximately how many are pain-free? So there's two parts to that question. The first part is how many people are pain-free after completing the program. I don't actually have a statistic. I have to be completely honest with you. I don't have a statistic that says like 100% are completely pain-free. But the main point of this question that I want to answer right now, the kind of thing that I'm noticing about this question is that the program is 12 weeks long, but I would say most people are not pain-free after 12 weeks. I'm just going to be brutally honest. It's a 12-week program, but that doesn't mean that your pain will be gone in 12 weeks. So ask any physical therapist who's honest. Okay. There may be some people out there who are not honest and could give you some promise. If somebody's giving you a promise of like 100% guaranteed to be pain free in 12 weeks, run screaming. Okay. I just want you to know that. Like, if you see promises out there of like 100% guarantee that in this particular timeline, you'll be 100% pain free guaranteed, there's no way that that is true. Everybody is different. And unfortunately, especially conditions like pelvic pain, which they often are very long, windy conditions that involve a lot of different aspects. It's usually not just like a single injury that caused the pain. It's usually something maybe initiated the pain, but then there's all sorts of other stuff layered on top of that. The fear about the pain, the fear about, oh my gosh, is my sex life ruined? The anxiety about, oh my gosh, why am I having these ups and downs? Like, there's so much layered on top that can then make tension and dysfunction in your body worse. And then stress can flare things up, which can bring on more fear, which can bring on more pain. Like, it's very multi-layered. And so it's usually something that takes longer than 12 weeks to resolve for anybody, for almost anybody. Now, that being said, some people find relief from my Overcome program or from pelvic physical therapy really quickly. Sometimes it takes them a month and they're like, man, I'm already feeling really good, but it's just everyone is so different. And I offer the 12-week program as basically you could get through it in 12 weeks, but many people spend 2 or 3 or 4 weeks on a single week of the program before moving forward. So for some people, it takes a year to resolve their pelvic pain. And I just want to be honest right there. I don't want to give anyone false hope. So that's just, again, real reality check right there. So then Lilies and Buttercup says, not strictly pelvic floor related. I feel like I'm starting perimenopause. High five, me too. And I can't sleep. I do think it indirectly affects my pelvic floor, and I have way less energy and motivation to exercise. Do I have any sleeping tips? Ooh, that's so good. Okay, so Lilies and Buttercups, if you'd like to unmute yourself, you're welcome to. You can ask to unmute. Um, so regarding sleeping tips, so first of all, this is going to sound really silly and like super low tech, but this helped me. I had a really hard time sleeping, and I didn't realize how sensitive I was to all sorts of stimuli. I didn't realize just how sensitive I was to light, to sound, etc. So I tell you what, earplugs have been a game changer for me and sleep, because I went through a period of time where I just could not sleep, could not sleep. And for me, it was a combination of managing stress. There were some things that were really stressful in my life when I was having a very hard time sleeping. So managing stress, but using earplugs. And for some people, an eye mask is something you might need to start using if you weren't doing that before, to cover, to make sure that you're very, very dark. The other thing that's so helpful for me is magnesium. So I take magnesium. I use Natural Calm, Natural Vitality, I believe is the brand, and it's called Natural Calm Magnesium. It's a supplement, but you can follow the package directions if you haven't already tried that. I love Natural Calm. It always helps me. I usually take it after dinner, so give it a little while before bed. I also have been known to take melatonin, and that's been helpful for me. There are herbal supplements like valerian that you could try, but I believe, don't quote me on this, but I believe with valerian, you need to not constantly take it. It's kind of taking it and then maybe taking a back off. Like, you need to be careful to not overdo that. I have a great tea blend as well that has chamomile and passion flower and calendula. That's really lovely before bed as well. But with those drinks, you don't want to take them too close to bedtime. Like 2 hours before bed, I think is helpful, because then you're not ultimately having to pee all night long. If you drink them right before bed, you're going to be getting up all through the night, and that's not fun. So I would drink those things before, like 2 hours before. And then, of course, the time tested advice to wind down, off devices, all of those things. So it's kind of all the basic stuff, but does Yeah, and oh, also weighted blankets, lilies and buttercups, weighted blankets, so amazing. Oh, it just soothes your nervous system, but they're hot, and so you might find yourself throwing it off if you try sleeping with it, but all those can be helpful. Did you wanna unmute yourself or, like, ask anything else? Yeah, good. Okay, perfect. If there's anything else, just let me know, but sleep is hugely important for, sleep is hugely important for pelvic health. As you were saying, I mean, we need sleep for good energy. We need sleep to stay motivated to maintain our healthy lifestyle. We need sleep to be able to think clearly so that we can, especially as we're learning about our pelvic floor and our pelvic health, it takes time to develop new muscle memory, to develop new habits and practices like how to lift things correctly. All of those things that we kind of have to reteach ourselves. And so we need sleep and nourishment, like from food, water, sleep, like all those basics. We need to have those down so that we can most effectively learn new things, learn new skills that we were never taught when we were growing up or going to school. We were never taught how to take care of our pelvic floor. So yes, sleep is super important. And yes,
Yeah, I think
perimenopause can
it's
mess it
really
up.
helpful. Yes, and I am only 35, but it is like I feel like it's just taking over.
Yeah.
But um I'm especially the magnesium because I also get kidney stones, and so magnesium can sometimes help that as well. So I'm hoping that that would be helpful.
Yeah.
Um and not drinking too close to bed, but trying to unwind.
Yeah.
So maybe
Yeah.
borrow my daughter's sleep mask and see if that helps. She's got
Right.
one.
They're so silly.
But does
I
anything.
resisted earplugs for the longest time. I mean, someone had suggested that and I was like, Whatever, that's silly. I don't need earplugs."
Yeah.
But oh my gosh, now I put them in and I kind of hear them going like expanding in my
Uh-huh.
ear. And it's like a trigger at this point to just go to sleep. So,
Yeah, that's awesome. Thank you. I appreciate that. And you being like putting this on and answering people's questions.
yeah.
I think you're fantastic. And
Oh,
I have been watching your videos for a very long time and just found them very helpful and holistic. And I find myself like applying things in any workout setting. I'm like, I need to push pause and like relax and shake it out. And it's like they just keep going. So thank you for all your help.
you're welcome. Thank you for saying that. I appreciate that because the stuff I teach is pretty simple and basic, but you're right. What I intend is the teach a person to fish motto. Like I want to teach you to fish so you can feed yourself for a lifetime. I want to teach you information, not so that you're always stuck with me, but so that you can apply it to every workout that you do, to the CrossFit you do at the gym, to the whatever the Zumba class you do, to like everything. It doesn't have to just be my stuff. Like the intention is that you apply this information to your life, not just to a single exercise or a single video or single workout. So thank you for saying that. Um, okay. So my husband, sweet Chris Grogan, thank you, love, put my website with a link to my Lift program and also a link to my Overcome program for anyone who's interested. So that's in the chat. For anyone, I think I'm going to put this replay on YouTube. So for anyone watching on YouTube, it's vibrantpelvichealth.com/lift and vibrantpelvichealth.com/overcome. It's too long. Overcome dash pelvic dash pain dash for dash women. Oh my gosh, that was crazy. Why did I do that? Okay, so um, Pat says okay, I think that it's okay for me to share this. There's a person who's had a total hysterectomy following a diagnosis. Okay, I'm gonna maybe hold off because I'm not sure if this is a private question. Pat, if your question for me was private, then please send an email to support@vibrantpelvichealth.com. And if it's not private, then type in the chat, not private, and I'll read it out loud. Okay, thank you. So Nicole Bruce says, I'm about to have endometriosis surgery and a hysterectomy. Do you think pelvic floor work before surgery helps with recovery? What do you think helps the best with the pain before surgery? My pain has gotten horrible and I'm not sleeping. Okay, Nicole, First of all, if you want to unmute yourself, you're welcome to. You can just ask to unmute and we can chat. I just want to honor you. Oh, that pain, endometriosis, pain. I don't have endometriosis, but I know how painful it can be. So the first thing is your pain has gotten horrible and you're not sleeping. So yes, this is going to happen. And part of it is that mind-body connection that I keep talking about and harping on. This incredible cycle. And I'm not saying that the pain is just in your head, but what I'm saying is that the pain, the physical pain from your physical issue, the endometriosis, it hurts so badly, and your nervous system becomes very sensitive to the pain because your body's always trying to protect you. And so our bodies will try to protect us by tensing and tightening up and also becoming more sensitive to the pain in an effort to like do something, sort of like do something. Oh my gosh, there's pain. We need to do something. We need to protect ourselves. There's pain. I'm noticing the pain. And so what can happen is that can cause more tension and tightness in our muscles and more pain. And it's this cycle. And so the best thing we can do to interrupt that cycle, it can be hard. I'm not saying this is easy, but recognizing that this pain is being amplified because of the nervous system's response to the pain and the endometriosis and all of the discomfort that you're struggling with right now. So interrupting this pain cycle by, first of all, I mean, everyone's different what they'll respond to best, but recognizing this pain is bad. We need to do something about this. And one thing that can help is for some people, just tapping on their body, just kind of getting into their body, dropping into their body, taking a deep exhale. Because sometimes if you tell yourself, just relax, that doesn't usually work. You're like, I am in pain. I can't just relax. I can't just tell my nervous system to relax. It doesn't work that way. So for some people, what you need to do is just like yell or shout or cry or shake out your body or do something that doesn't involve a lot of physical activity, because you probably aren't wanting to move much if you're in that much pain. But just strong exhalation or kind of shaking out your shoulders, maybe tapping on your heart, your sternum area, little butterfly taps, slowing it down. And maybe after that, you can come into your body. You can take some calming breaths after that, after kind of getting out some of that pent up energy from the amped up nervous system. Releasing some of that pressure can help you then bring in some calming, soothing breath work where you really lengthen your exhalations. Focus on being in your body and not trying to run away from your body and dissociating from your body, but being in your body, noticing that you're planted butt on chair or body in bed. Feel your body in the bed. Feel your presence in the room. Remind yourself that you're in pain, but you're safe. All of these things can be helpful. They're not instant relief, but they can be helpful with the pain. And then regarding the surgery, absolutely, pelvic floor work before surgery helps with recovery, 100%. And I don't know if you joined after I said this, but one reason that I encourage like my programs or going to a pelvic floor physical therapist is because if you don't, I always say, if you don't fix it, it will follow you. So if you don't do the work of learning about your pelvic floor muscles, about learning how to care for your pelvic muscles, learning how to release them or strengthen them based on whatever your needs are at the moment, if you don't learn how to live a pelvic floor friendly lifestyle, if you don't learn these things before surgery, they're just going to keep perpetuating after surgery. And so in some cases, they can make surgery, depending on the surgery, not as effective. They can make also surgery recovery harder because you aren't as in touch and in tune with your body. You aren't as engaged and coordinated with your pelvic floor muscles. Doing that prehab work beforehand is just going to make you that much stronger and that much more aware after your surgery. And you can redo the exercises that you did before surgery as rehab when you're ready and when your doctor clears you to exercise again after the surgery. So you can do the same set of exercises before surgery and after surgery. That's why, like, if you were to do one of my programs, I would say do it before surgery. And then when your doctor clears you for exercise, you would go back to the beginning of my program and redo it when you're ready after surgery as like rehab. So I hope that answers your question. And if you wanted to chat, you're welcome to unmute yourself. I'll take a breath and a drink just in case you wanted to pop on, Nicole. I'm not hearing anything, so I'm going to keep going. KK, another question about magnesium. Do I take magnesium every day or only as needed for sleep? So for me, I don't remember to take it every day. That's just me being honest. I don't take it every day. I usually take it more as needed and kind of when I remember it, but I find that it's very helpful. Okay, do you have tips for painful penetration is the next question. My therapist gave me a dilator and I tried different lubes. A lot of them are irritating. I found one by Yes that works better. Any advice would be appreciated by me and my partner. Okay, great question. So yes, I have lots of tips. First of all, I love that you found a lube by lubes are hard. You want to be careful with your lube, and I don't have a specific brand. The one I know that products by Yes are wonderful, so I'm glad you found that product. They tend to be more natural. I use slippery stuff when I'm working with clients in person, but there are many other natural lubes and ones that you want to avoid anything with anything strange like scents or like warming devices or anything like that. As natural and simple as possible is typically better. But beyond lube, one thing that's really important is, first of all, you need to really be, this is going to sound maybe kind of out there for some of you, but I talk about it a lot in my new academy program, the Mind Body Pelvic Health Academy, is honestly, consent is so important. So we can medicalize these types of therapies like dilator use. It can become really clinical and medicalized, and just like this procedure that we're doing on ourselves, that's like a therapy, like this, like a medical procedure that we're doing on ourselves. And it's like we got to get it done, like something to check off our checklist. I've got to get my dilator therapy in for the day. I've got to do this. And dilator use can be wonderful. I'm not saying dilator therapy is bad, but anytime we're working on our bodies, especially this very intimate area, and especially when we're doing it to help with something intimate like sex, it needs to not just be this weird medical like procedure thing that we're doing to ourselves and something to check off the checklist. So it's already a scary thing because it can be painful. It's painful. That's why you're doing this. So it's already like a nerve-wracking thing that you're doing. And so the setting needs to be so supportive of a really sweet and slow and intimate experience with yourself. I'm not saying it's going to necessarily be sexually pleasurable to use the dilator, but you need to take the time to be sure that you're not just checking something off your to-do list. And I don't know if that's your situation at all, but I know many people, it kind of just becomes a chore. And so the more you can prepare for your dilator therapy, your dilator use, by going so much slower with yourself than you think you should, by literally asking for consent from your own body before you insert anything. Even asking for consent to put your hands on your inner thighs or your hands on your belly. When was the last time you asked yourself for consent from yourself? Like, most people don't do that. And it's very powerful, and it might make you cry, and that's good. We hold so much emotion in our pelvic area. We have so much emotion, so many things, so many times we were penetrated before we were ready. So many times we had sex even though it hurt. So many times traumatic things happened. Not for everyone, but in some cases that's part of the history that we carry. And so we need to address that by going so much slower and so much gentler and so much more intentionally with consent. Even if you're just touching your own body or using a dilator, it can't just be something you're marking off your to-do list. And so, I mean, for me, I would have you warm up through some gentle stretches and breathing exercises. I would have you touch your legs and your belly, your hips before you even touch your vulva, or certainly insert a dilator. I would have you always ask for consent from yourself. I would have you lube the heck out of it so it's as, comfortable as possible. I would have you warm the lube. I mean, really take it seriously. It's not just a thing to check off your to-do list. Because if it is just a thing to check off your to-do list, and if things happen too fast and it causes more discomfort, then your body's just going to tighten and clench up even more. So it's like you have to continue to establish more and more trust with your body. And the way to do that is by going slow, 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 slow. So, and it might mean that it's going to take you a lot longer to progress with your dilator therapy than if you were just, using them on some schedule. But that's okay. It's worth it because it's going to allow you to develop that trusting relationship with your body. Okay, so I hope that helped. And if you, the person who had that question, if you'd like to unmute yourself, you're welcome to. Manasi Joshi Singh, I hope I said your name correctly, says listening to YouTube sleep frequencies music is very helpful for me for sleep. That's a great idea. Yeah. And Nicole Guapon, hi Nicole. Nicole's one of my academy graduates. She says a white noise machine is a non-negotiable for me. Same with an eye mask and occasionally earplugs. Ooh, some good sleep tips here. Okay, so and then really quickly, Nicole says warm lube was a game changer for me. And this is about the sex question, not lube with a warming ingredient, literally warming up any lubricant. And that's what I meant too. Exactly. We don't want the warming ingredients in the lubes. No, no, no. But literally warming it, even if that's just like, warming it in a hot water bath or warming it on your hands, maybe kind of blowing with your breath on some lube on your fingertips. I mean, anything to just take the edge off. Now, Pat says not private. Okay, so the message, I'm going to go back. And I think we probably have time maybe for one more question after this. So Pat says, I've had total hysterectomy following a diagnosis of ovarian cancer and now have bladder prolapse. I am reluctant to have more surgery. Would the LIFT program be of benefit? Yes, absolutely. So why I love my LIFT program and what makes it really special, in my opinion, is that it's all about lifestyle management tips. It's even more about lifestyle than it is about to me, that's the most important part. It's even more important than the specific exercises. So the lifestyle tips that you learn throughout LIFT, first of all, are going to help you in the beginning. They actually just help you learn how to identify your pelvic muscles and relax and release the pelvic muscles, which are so often tight, especially in people who've had a lot going on in their pelvic area. Pat, you've had total hysterectomy, ovarian cancer. You've had a lot going on in that part of your body. You've had a lot of procedures and probably a lot of anxiety and fear. Therefore, it's likely that you probably have some tension in that area. And then when people start developing prolapse, when there's a shift in the position of their pelvic organs, what often happens is the muscles in the pelvic area unconsciously, in an effort to protect and keep everything in and keep you supported, your muscles tighten up, which is sort of sweet that our body's doing that. It's an unconscious reaction, reflexive mechanism that our body naturally does, but it doesn't really help always, because sometimes all that tension makes the prolapse more sensational. You can feel it more. It kind of keeps everything in the position of prolapse. It can change your alignment. It changes the balance of your muscles. It makes your muscles tired because tight muscles are not strong. They're exhausted. So all of these things can happen as a result of prolapse. And so one of the first things we do in LIFT is to work on kind of releasing those muscles. And we talk a lot about posture and alignment and strategies to manage the pressure in your pelvic area. So we're not always having this kind of downward pressure happening. So I teach you pressure management strategies, and all of these things are going to really help you with the bladder prolapse and are going to potentially help prevent surgery. Or if you just choose not to have surgery, it's going to help you manage your prolapse and learn how to live life well, even with prolapse. Even if you still have a diagnosable prolapse, and let's say the grade never changes with lift, you're going to learn how to live better with your prolapse, not feel it as much, not worry about it as much, and it's going to help prevent things from getting worse. So I would say absolutely yes. If you're wanting to avoid surgery, then I would definitely recommend my lift program. And, you know, always it's nice to see a pelvic floor physical therapist in person if you can as well. Okay, so I think I mentioned, let's do one more question. Yeah. Okay, so this is the last question we'll do today, and I want to just thank everyone for your attention and for being here. So this one again is from Manasi Joshi Singh. Again, I apologize if I said your name incorrectly. How valuable is an MRI defecography test, do you think? With a background of pelvic floor dysfunction, I'm suffering from irritable bowel syndrome and methane SIBO, causing constipation, mainly the kind where I actually go regularly, in fact, too many rounds of trips to the loo, and the final rounds of incomplete evacuation and sensations. Also have a recently identified grade 2 rectocele, so I'm trying to figure out whether to do the MRI or not. Okay, so I've never done the MRI defecography test. What I can say is I have a twofold answer. So on one hand, I think they're cool. These tests are super cool. In fact, I mean, and by cool, what I mean is they can show you a lot. They're very interesting what they show you. And I think they can be very helpful for the provider you're working with, the surgeon or the, you know, the doctor you're working with, to help understand what's going on visually, what's going on inside. That being said, I've heard from people who've gone through similar tests. I mean, there's many different types of these, but there's some that are more involved, some that are less involved. Again, I'm not a person who does these tests, so I don't know all the details, but I know some people who've done defecography tests and different types of testing like this that's pretty invasive. And I've had people really have traumatic experiences with these tests because they just feel so you know, they're having to poop, pee, you know, do things like that in a controlled situation. It can be really uncomfortable, and in some cases really cause people a lot of mental and emotional distress to have to do these types of procedures. So I think it really depends on if you want it. If you think this would be helpful for you, if you're mentally prepared to do something like this, to be in a hospital setting and do this type of testing, I would really look into it so you know what to prepare for mentally, and just give yourself some pep talks before going into it. I actually have a really cool meditation on my YouTube channel, and I can't remember what it's called off the top of my head, but I think it's called like meditation to prepare for pelvic surgery. And this is not pelvic surgery. It's different, but you might want to do a meditation similar to that one that I have on my YouTube channel, just to kind of mentally visualize a really positive outcome in a hospital setting, because it can be exposing and vulnerable to do a test like that. So that's my thoughts. Okay.
Thank you. Thank you
Yeah.
for that.
Oh, you're welcome. You're welcome.
Yeah, the reason I was asking that, I mean, sorry, I don't mean to take up a lot of time, but
No, you're fine.
yeah, the perspective was, okay, after I do it, I mean, basically I've been to a urogynecologist, GI, all the plethora of, you know, people, and they haven't said anything about any surgical need or anything like that. But my thought was, okay, if I do it, and then like, what is going to be the solution like suggested after that? Like what's going to be the outcome of that analysis? And that's where I'm trying to figure out, is it ultimately going to come down to, just saying that, oh, you have some dyssynergia, in those muscles, like the coordination is off or whatever. And is it pointed enough to help me exactly what kind of PT I might then have to do or whatever? Because I work already with a PT, also a live PT, as well as I do some like online programs, as well as I've been following your videos, and it's I'm just trying to figure out what the risk of, I mean, not the risk, but as you exactly said, like I've been through a lot of different kinds of testing, including colonoscopy and this and that. So I'm just figuring out whether this is really worth going through, or
Yeah.
am I going to just end up getting some small little piece of info?
I mean, I think all puzzle pieces, all information can be good information,
Good.
to provide for your
True.
doctor, but also provide to your physical therapist who you're working with. I mean, it can all be helpful, but if you're already working with a physical therapist who's probably identified dyssynergia, that's the hardest word to say, but lack of
Yes.
coordination, things like that.
Mhm.
If you're already working with a pelvic floor therapist, they're going to know your grade of prolapse. They're going to know your muscle coordination. So I don't know. I think it really comes down to if you want it,
Sure.
and if you think mentally you can handle it. That's my humble opinion. So
Right. One piggybacking on this, one last question
yeah.
is that if so there is this thing like that they call biofeedback that they'll do at a PT's office. I've never had it done too extensively, but my question to you is there some value from something like biofeedback, given this kind of background or potential of dyssynergia or whatever, and also in your like from your guidance, like do you have any exercises or anything that I could try out which might help with that situation?
Yeah. Biofeedback I think is wonderful. And I know people with dyssynergia who have used biofeedback very successfully in helping them understand, because you basically are getting a visual representation of what your muscles are doing. If it's hard for you to feel them, which it can be really hard to feel, especially with the history of SIBO, like you mentioned, and the
Mhm.
diarrhea and all the things that you've been dealing with, it can be really hard to actually kind of feel and
Yeah.
identify with what's going on. So you can see on the screen, depending on the unit you're using, but you can see what's happening, whether the muscles are tensing up, whether they're relaxing, etc. So yes, I think it can be valuable. As far as my exercises, what I focus more on with biofeedback and what I think can be really helpful, because even like a device such as PeriFit or LV are two brand names that I'm familiar with of products that you can purchase over the counter to help with pelvic floor strengthening and release work. And those are
Okay.
biofeedback devices. That's what they are. And so
Okay.
the nice thing about them though is what I like to focus on is less about like the strength of contraction, but more about the release,
Mhm.
like
Yeah.
whether or not your muscles actually are releasing. And the key there though is to make sure that it's actually your muscles releasing and it's not you like bearing down, right? Like it's very nuanced, but
Yes.
they can be very helpful tools. I personally am very low tech with my work. And so my main tool is like manual biofeedback using your fingers on your perineum to actually
Okay.
see and sense with your fingers what's
Yeah.
happening, to see and sense if you can feel a gentle lift of your pelvic floor muscles and then also feel a gentle release. So it's
Mhm.
not going to be a massive movement, but you should
Sure.
feel a little something. You should feel a lift and you should feel kind of a softening into your hands when you are intentionally releasing. You can even feel it when you're breathing, deeply breathing. you know?
Right.
So I talk about this in my program. I do have a program called Begin that I haven't mentioned yet, but it's vibrantpelvichealth.com/begin. And it's a really simple, it's a mini course that talks really about release work of the pelvic floor. Because I think it's an important starting point for everybody is release work. So that's from me, from my end, that's what I'd recommend. So.
Okay, great. No, thank you. That
You're
was
welcome.
very helpful. I
Good.
really appreciate the time. Sorry, I hogged the time for
No, you're
other
fine. You're
people.
fine. That was really helpful for everybody. Yeah. Okay. So I'm just gonna, I think we're good. Yeah. Decided to look at you, but yeah. Okay. So nice comments from you guys. Thank you for being here. Windows 10 said, can you write the name of the 2 devices you just mentioned for testing release of pelvic muscles? So I'll just say them out loud for anyone watching the replay, but the 2 devices that I know of are ELVIE, ELVIE. I want to just let you know, I haven't actually looked into LV in a long time. I hope it's still available. I think it is, but ELVIE. And the other device is PeriFit, PERIFIT. Now, there are many other devices out there. Those are just 2 that I've personally used and tested myself. And in fact, if you were to look on my YouTube channel and search PeriFit and LV, I have videos from a long time ago that talk about both of those devices. The PeriFit video is a little bit newer. So, yeah. So I'm so glad you guys are here. Thank you. Thank you for being here. Anne says, thank you, Dr. Bree, for your knowledge and time. This is so helpful. I'm going to my first pelvic floor therapy today for urinary incontinence and occasional pain. Awesome. I'm so glad. I mean, when you can find a pelvic floor PT who you mesh with and you gel with and you feel good about, it's so helpful. And definitely, if you don't mesh with your pelvic floor PT, look around and find another if that's a possibility for you. Because it's a really intimate and, sacred part of our body. And so it is important to find a match. And just always remember that my programs online are available for at-home support. When you go to a PT, sometimes our insurance will only cover like 1 visit. And so it can be really helpful to have a program you can do in addition to the work you do with a physical therapist. So if you're interested, my website, Vibrant Pelvic Health, has my more foundational programs, like that little mini course I just mentioned called Begin. It also has my Lift and Overcome programs. And then my BrianneGrogan.com website, different website. It's kind of like the next level stuff. And it's so special and magical, but they're all so important. So start with vibrantpelvichealth.com if you're new to my work. And of course, I have my free videos on YouTube as well. But thank you for your time and energy. And I really appreciate you all. All right. Yes, you're welcome. You're welcome. Okay. Bye, guys.